Hello everyone, it's Chematic Med, and today we're going to continue the coagulation cascade medication part 2, and we will talk about methemoglobinemia. In clinical settings with warfarin and heparin, you will also see direct factor 10 inhibitors, also called active 10 factor inhibitors. This group includes rivaroxaban and apixaban, both of which are oral medications. On the other hand, fondaparinux is an indirect inhibitor of factor 10. Another medication group is direct thrombin or factor 2 inhibitors. These include argatroban, bivalirudin, and dabigatran, which is oral. This medication directly inhibits thrombin activity, impacting clot formation. Additionally, I want to talk about the factor 8 deficiency. Factor 8 deficiency or hemophilia A leads to increased PTT, normal PT. Now we know why, because the 8 factor was part of the intrinsic pathway, right? And this condition has tendency for prolonged bleeding, often requiring factor replacement therapy. Sometimes inhibitor development can occur in 25% of patients with severe factor 8 deficiency. It should be considered in a patient with bleeding refractory to replacement therapy or with increased bleeding frequency. Now let's talk about methemoglobinemia. Acquired methemoglobinemia results from the oxidation of iron in hemoglobin, which is most commonly due to topical anesthetic agents or dapsone. It presents with hypoxia, a characteristic pulse oximetry reading of approximately 85 and a large oxygen saturation gap. Additionally, some drugs and nitrites can be caused too. Inside the hemoglobin, iron should be in ferrous state, which is 2+ state, and if oxidation occurs, it will be converted to ferric state, which is 3+, reducing its ability to bind and release oxygen efficiently. This can bind tightly the cyanide, preventing it from excreting, causes dusky skin discoloration, and cannot carry oxygen. Thank you, bye.